and physical and often challenging journeys of fertility together. I'm your host, Nkechi, and NK for short. I'm grateful to have every one of us here today. This is episode 10, and this is the second in our new series, Understanding Fertility and Treatment Options. Today, we are delving into the topic of overcoming tubal factor infertility in 2025. I am incredibly excited to introduce our guest. He has become a member of the family, Dr. Chukwudi Ufondu, a renowned fertility specialist and a doctor who has dedicated his career to supporting couples on their journey to parenthood. I'm sure you're going to really love him today. So, whether you're just starting your journey or you have been on it for years, I hope this conversation brings you understanding and valuable information. So, let's start. As you know, like our tradition here, we would always set the tone for the day with a Bible passage, that resonates with us. Today we'll be reading Deuteronomy 28, verse 8. And it says, the Lord your God is giving you the land, and He will make sure you are successful in everything you do. Your harvest will be so large that your storehouse will be full. So that is the word for today. The land is where you live, your workplace, your business, the country where you reside. And for the Lord to make it successful, what you do, He has to find you adding value and then promoting the kingdom as well. So as He pours into you, He's expecting that you pour into others and make it work for them. So thank you so much. Thank you for having us today. So, Dr. Chikudi, welcome, Doc. How are you doing today?
Yeah, I'm doing good, Kechi. It's good to be back to your
Yes,
channel,
yes, yes,
Fertility
yes.
Diaries, and it's amazing anytime I have an opportunity to share my experience and my expertise towards helping families. So today we're going to talk about tubal factor infertility.
Yes.
And tubal factor, it's one of the major challenges that so many people are going through. So we're going to look at, a couple of important things you need to know about the tubal factor. And I have my
Yes.
teaching aid. So I'm going
Yes.
to illustrate, and
Yes.
you have an opportunity to ask all your questions. So if you have any challenges becoming pregnant, and they told you it's one of your tubes or both tubes that got damaged, we're going to dissect the true meaning of tubal factor and what you can actually do to overcome this tubal factor and still become pregnant and still achieve motherhood. So that's what we're going to talk about today. And it's very important to pay attention, take notes, and subsequently, if you have these problems and you're in Nigeria, depending on the location where you are, you can also follow through and we can connect you to few collaborating fertility experts who will help
Yeah.
you because it's not just enough to identify problems. When you identify problems, you also have to find solutions. So my
Yes.
organization, Snowspirations Global Health Solutions, is actually a solution-oriented fertility outlet. So we help you to overcome infertility. We help you to become pregnant. We help you to have successful pregnancy and of course,
Yes.
successful delivery. So that's my aim this afternoon. Thank you for this opportunity.
Thank you so much. Thank you, Doc. Thank you so much. In a way, you've summarized the topic for today. So let's delve into it. What is tubal infertility? What does it stand for? What's the summary of what it really is? Because I know a lot of people are like questioning what is it?
Okay, so Kechi, thank you so much. So I'm gonna generically give you a quick overview of the female reproductive system. So this is the internal
Okay.
female reproductive system. So every
Yes.
woman present in this forum this afternoon, you have this beautiful female reproductive system. So it starts with the vagina, then it
Yes.
goes beyond the vagina, it gets to the cervix. So the cervix is a very important junction between the vagina and the womb. So this beautiful structure is the womb. So this is where your baby develops, right? Then when you go up, you can see these two horns sitting pretty.
Yes.
So this is
Yes.
your fallopian tube. This is the right fallopian tube. This is the left fallopian tube. Then just
Okay.
beneath the fallopian tube, you have your ovary. So this is the left ovary, this is the right ovary. Now, for pregnancy to happen, the man will ejaculate through the
Yeah.
vagina. And when you
Yes.
ejaculate, you release semen. So inside the semen, you have the sperm, which will pass through the vagina, pass through the cervix, get into the womb, then begin the upward journey to the tube. So pregnancy actually happens in the tube. Then after
Okay.
pregnancy is achieved in the tube, it will come down to start developing in the womb through the process of implantation. So tubal factor infertility simply means we have a damage somewhere in the tube. It can be
Okay.
a congenital problem. So congenital problem means you were born with a problem, or it can be an acquired problem. It means you developed the problem. So there are various parts of the tubes. So this part of the tube closer to the ovaries is called the distal part of the tube.
These two.
The
Okay.
part of the tube closer to the womb is called the proximal part. So the part of the tube closer to the womb is where the sperm will come in. So if you have a tubal blockage somewhere here, the sperm can come in. It will lead to
Yeah.
infertility. If you have a tubal factor problem, blockage or damage on the distal part, the eggs can come in. Pregnancy will be impossible. Now, in some
Impossible.
situations, depending on the severity of the tubal damage, the eggs can come in, the sperm can come in. But unfortunately, after the formation of the embryo, which is the union of the egg and the sperm,
And
pregnancy
sperm.
will start developing in the tube. This is a deadly scenario. This is a deadly situation. Pregnancy is not meant to, develop
In the
in.
tubes.
So pregnancy starts in the tube, continues to develop in the womb. So this particular type of pregnancy is an abnormal pregnancy we call ectopic pregnancy. Once we identify that, we have to remove that pregnancy and unfortunately cut off the tube. But guess what? God is an amazing God. So
Very.
anytime God anticipates a challenge, God also provides a solution. So the
Yeah.
reason why God gave women two tubes is to compensate. So conventionally, what you need to become pregnant is actually one healthy tube. So your two
Okay.
tubes can alternate in performing their role, which is to provide a forum, to provide a platform. So consider your tubes like the bridge, the natural bridge. Without the tubes, natural pregnancy cannot happen. So
Cannot.
if you have problems in one tube and the other tube is healthy and open, you can still become pregnant. The only thing is your chance of becoming pregnant is reduced to
Limited.
50%, but pregnancy can still happen, including multiple pregnancy. So what a woman needs in actuality to become pregnant is one healthy tube. Once you have one healthy tube and you have availability of the eggs and you have availability of the sperm, pregnancy can still happen. Now, when you talk about tubal factor infertility, top
Yeah.
on the list of things that can actually affect the tubes, it's a condition we call pelvic inflammatory disease.
Okay.
So pelvic inflammatory disease is a complex kind of condition which is caused by two bacterial infection, sexually transmitted infection, chlamydia or gonorrhea. So when you have these two bacterial sexually transmitted infections, if they are not properly treated, they love the tubes. So they are an ascending infection, they go to the tubes and they start damaging the tubes. Unfortunately, most women that have tubal damage problems will not present with anything because it's only when they want to become pregnant that they will discover that
Yes.
pregnancy is not happening.
Okay.
And when we send them for investigation, like HSG, hysterosalpingogram, which is a very important test, we will use to confirm if your tubes are open or not. That's when we'll discover that this woman has problem, and by then it might be late. So this is why
Yes.
it's very important to work with a fertility specialist. So one of the major players in tubal damage is pelvic inflammatory disease. So when you have this, it navigates to the tube and it causes problem, inflammation, adhesions, blockages. Now, sometimes you will also have inflammatory process in the tube, leading to a condition we call hydrosalpinx. So your tube will accumulate a lot of deadly fluid, which will narrow the
Fluid. Okay.
movement of your tubes, and it will no longer perform its role. Unfortunately, there are some women that might also be born with damaged tubes from birth. Now,
From
some
birth.
women might have
Mhm.
very humongous fibroids that can also occlude the tubes. So these are the biggest players in tubal factor infertility. Now, of course, if you have ectopic pregnancy, unfortunately, depending on the extent of the ectopic pregnancy and when it was diagnosed, you're going to lose that tube. through the process of
Oh,
sapectomy because it's an emergency and pregnancy is not supposed to exist and develop in the tube. So what we do
tubes.
is to stop the pregnancy and cut off the tube through the process of sapectomy. But like I mentioned, once the other side is healthy, you can still go ahead and have all your babies. Now, worst case scenario, the two tubes are damaged. Can you still get pregnant? Yes. What do? We think outside the box. So because
Yes.
the natural rule of the tubes are already taken over, we forget the tubes. We now revert back to IVF. Why IVF? Because you still have your eggs. So once you have your eggs, we can take care of your eggs. We can collect the eggs. We can collect the sperm. Now it's going to be outside the body of the woman. Once we achieve pregnancy, then everything will be perfectly okay. Once we achieve the creation of the embryo, we transfer the embryo back into the woman, and the woman will be pregnant. So tubal factor infertility, it's important we diagnose it on time. Then depending on the extent of the damage, there are different modalities for treating it.
Okay.
So that's just a preamble as we continue.
Okay. Thank you. Thank you so much, Doc. Okay, so you've actually summarized it. Well, I wanted us to break it down. Like at what point? Because for most people, yes, they agree that yes, I'm blessed with two tubes. Oh, what point do I start? Do I start, really question, is there physical signs, or I just have to go the medical route to be able to find out that I have a blocked tube?
Okay, so here's the deal. Unfortunately, majority of women that have tubal factor infertility might not even know they
Hmm.
have it.
Yeah,
It's only when they want to start having babies that they will actually go for tests
go to check.
and will discover that the tubes are blocked. So majority of women, because most times we don't take certain things serious, like most single ladies. So most ladies that are not married might not have gone to the hospital. So we brag that, oh, I don't normally go to the hospital. I don't go for my well woman check. But if you have this habit of going for your well woman check and you want to have a baseline, so baseline means every year we have everything, your
Everything.
complete hormone profile, your complete blood count, your complete metabolic panel, and of course, we run your fertility profile. So one of your fertility profiles is to run hysterosalpingogram. Hysterosalpingogram is a test we use in checking the patency. So patency means is the tube open or not? So by default, if you really want to be ahead on time
Yeah.
in regards to tubal factor, you have to think ahead on time. So what do I mean by thinking ahead on time? You plan ahead on time. So you don't wait to have infertility before you begin
Before
to
you start.
HSG. So if you meet your partner and you guys are interested in starting your family, you go for your baseline fertility workup. One of the workups is to go through ultrasound, go through HSG. Then what we have will now be a template we can build on, because in infertility can happen to the man, infertility can happen to a woman. So once we discover one, we rule it out. So once we rule out that the tubes are okay, then we won't focus on the tubes. We focus on other aspects of the fertility profile. Now, of course, because you know that one of the causative factors in tubal factor infertility is sexually transmitted infections. So
Yeah.
you should also be very much aware to prevent contracting sexually transmitted
Sexual.
infections,
Okay.
especially gonorrhea and chlamydia. Thankfully, when you have gonorrhea and chlamydia, they are both a bacterial infection that can be completely cured. They are completely treated and you will be completely okay. But the problem is, some people might present with symptoms, some people might not present with symptoms. So people are not way, open to seek help early unless it's really,
Early,
really late.
unless it's
But if
important.
you identify anything abnormal about your body, you seek help. Because if you have gonorrhea and chlamydia, we can completely treat gonorrhea and chlamydia, preventing you from possibility of developing pelvic inflammatory disease. Now,
Yeah.
sometimes you will do everything right and the tubes will still be damaged. The tubes are very, very sensitive. So unfortunately, depending on where you live, if they don't have subject matter specialists that can actually go through repair of, there are some people that might be lucky if they have microsurgeons. Those problems you have in the tubes, like blockages, like adhesions, we can carefully go to the tubes and we can correct them, we can remove them. But the
Correct them.
problem is, because the tubes are very, very sensitive, the more you go in there to correct problems to operate on it, by the time it's healing, it will heal with more adhesions.
Uh-huh.
So we don't want to take chances. Now, there are some women that might have moderately blocked tubes. or moderately damaged tubes, and we can recommend the so-called flushing. So I'm sure you're conversant with a lot of women telling you, I've got to
Very.
flush my wombs and tube and all that. So some people can
Yeah.
actually go through the process of hydrotubation, but it's not everybody
Yeah.
that is beneficial on. But the good thing is, thank God, God gave us an alternative. So in the situation that your two tubes got damaged, it's not the end of the world. You just have to accept your reality and brace up and go for assisted reproductive technique through the process of IVF.
Yeah. Thank you so much. So it's good news to hear that there are solutions, there are treatments, because I personally went through a tubal blockage and I know the process. I had to go through. I did hydrotubation just to flush and all that, and eventually one was true and the other one was like, no, it's totally blocked. They couldn't do anything about it. So I know that, yeah, there are solutions. So um for a lot of people out there, they might be overwhelmed by, oh, how much will it cost? Or is this something that is painful? I hear a lot of my friends say, no, I can't go through that process. It's really very painful. What's the advice or resource you recommend to women like that who are a bit scared or skeptical because they feel it might be expensive?
Yeah, so here's the deal. Normally, people have different pain thresholds. So
Yeah,
I've heard a lot of women complaining and freaking out whenever you talk about going for HSG. The truth
yeah,
is, the body of a woman is very, very sensitive, and people tolerate levels of pain. So generally, it's advised that if you're gonna go for HSG, your doctor will give you some analgesics, and some
yeah,
people might also require getting some GA, gestational analgesics, so to reduce the pain, to reduce the discomfort. Now, the reason why some people might experience that pain is because you already have an existing infection or inflammation, which will further make that area to be painful. But
be
ordinarily, what
sensitive.
you're supposed to experience is just discomfort and some level of pain because we are going into your body and your body is
Yeah,
very sensitive. So people have different levels of pain they can tolerate. So there are some people that can tolerate 10 over 10 pain, then there are some people that might not tolerate 1 over 10 pain. So it's all individualized.
okay, okay, that's good. So in the you've talked about is that if eventually it's discovered that the both tubes are blocked, that we can go through the process of IVF or any other assisted reproductive transition. So in that case, what are the options that this person, apart from IVF? Not everybody really opts for IVF so easily. Can they do IUI or any other one?
Yeah, so it depends on the severity. There are some
Okay.
women that might have mild blockage. All they need to do is to go for HSG. So by default, anytime you're going for HSG, if you have a mild blockage, that HSG flushing of the fluid and the force will open your tubes. So this is
Yeah.
actually the reason why you will hear a lot of women when they want to give their testimonies, they'll be like, I've been having infertility for 10 years and I met my doctor and I went for HSG. Then suddenly the Holy Spirit visited
Yeah.
me in the night. Simply that tube that got little blockage that in course of going for HSG opened the tube. So HSG by default will improve your fertility. Now, some women, depending on availability of resources, might benefit from hydrotubation. Some women might
Yeah.
benefit from microsurgery of removing the blockage or the inflammation or whatever. Now,
Yeah.
like I mentioned earlier, if one tube is damaged, but the other tube is healthy. So the determining factor, the rate limiting step is the health of the remaining tube.
Yeah.
If one tube is healthy and one is damaged, you don't have problems. You can still become pregnant naturally, and you might be a candidate for IUI. So IUI is an option, but there are criteria that must be met before you go for
For
IUI.
IUI. Okay.
IUI stands for intrauterine insemination. It simply means we are not going to allow the penis to perform its role. We're going to collect the sperm and we introduce it directly into the womb, hoping that
Oh,
the sperm will now swim to the tubes. So, but the criteria for IUI is to make sure the woman is ovulating, number one. And number two, you
okay.
at least have one open tube because without having any opening of the tube, then IUI is wasteful. So, if both tubes are damaged, the only option left for you is IVF.
IVF.
If one tube is damaged, then pray that the other tube is healthy. You can still become pregnant naturally, or you can go for IUI. Then when IUI fails and natural pregnancy fails, especially if you're in your 40s, the earlier you go for IVF, the better.
The better. Okay.
Yep.
Thank you so much, Doc. Okay, so we have talked about, things we can do, tests we can carry. So for tubal issues, is it just HSG that can help?
Yeah,
Is it
like
just HSG?
the diagnostic method of choice is HSG, hysterosalpingogram. There are
Okay.
other advanced protocols we can use. There are other advanced diagnostic protocols we can use, but this is the easiest one we can do that is easily available out there because
Okay.
diagnosis is very important. Anytime you're
Very.
having any challenges, proper diagnosis is very important. That's why you don't want to go doing all this stuff by yourself. You want to go through a doctor that will give you a prescription. You go, then when the
Yeah.
report comes back, you come back, we interpret it. So I'm gonna limit it to only HSG for
HSG.
diagnostic criteria. Now, of
Yeah.
course, when you have any problem in the whole reproductive pathway, the earlier it's handled, the better. Like I
The
told
better.
you, there are some fibroids on the body of the womb, which is called the subserosal fibroids, that might be so big. So imagine having a very big fibroid on this part of the womb. They can be so big to occlude the proximal
Yeah,
part.
they will block you.
When that happens bilaterally, possibility of pregnancy is gone. So it depends on the presentation of the individual. That will determine how we're going to manage it.
Okay. All right. Thank you so much, Doc. So, thank you, Doc, for shedding light on this. And before we wrap up, because it's a topic that needs, we need to talk about more often. I do have a lot of friends who had tubal blockages, and like you said, they just went for HSG, and their tubes were free, and they got pregnant naturally. Maybe one or two eventually just had to do IVF and still got pregnant through IVF. So, um, what final message you have for our listeners today who might be facing tubal factor infertility before we start asking them more questions?
Yeah, so here's the deal. Look, when you know better, you are better.
Yeah,
When you are better, you get better. When you get better, definitely you're still going to actualize whatever dream or aspirations you have. One of the things you have to do as a mother to be, as a father to be, is to face your reality.
yeah.
Facing your reality means at any point in time you notice you're having challenges, seek appropriate care.
Oh,
Go to the appropriate doctor. There are so many doctors out there. Seek appropriate care under a fertility specialist. Some people go about fixing things they can't fix using the wrong thing.
very true.
And in course of doing that, they damage an already damaged tube. There are some women that take a lot of herbs, a lot of concussions. They go to so many places. By the time you're doing all those things, you are making a bad situation worse or a
Was
worse situation worse. So go through the right channel. There are steps. One thing you have to be afraid of, one thing you have to face is your fear. When you face the fear of what could happen, then you can defeat that fear, then you can step into your glory. So there are so many people you will see with their babies, and you won't really know what they went through to have their babies.
yeah,
Everybody goes through challenges. It's
yeah,
just that most people don't really come out to tell you what they went through. There are some
true.
people that actually had worst case scenario compared to whatever you're having now. So regardless of the challenges you're having, if you're currently having tubal factor infertility, number one, who diagnosed it? Now, if we diagnosed it, did we classify it? Do we understand the pathway of the damages? If we understand the pathway of the damages, how are we managing it? Who is helping you with it? What's the severity? Are both of them affected? Is one okay? What are your chances? In life, you have to look at your chances, your odds, your probability. So when you know your chances, your odds, and probability, then you can begin to think outside the box. Most of us have a boxed up, limited approach to knowledge because knowledge is like the light. When
Yeah,
entrance of light will definitely set you free. So leverage on the opportunities we have lately. There are few providers out there that provide knowledge and teaching free of charge. We do that pretty much every day. Simple knowing what to do can change your situation. So I don't think there's anybody out here that can become a mother, regardless of whatever challenges you're having. The difference is the action you take. So take actions. The earlier you take actions, the better.
better. Okay. Thank you so much, Doc. So I just dropped a chat. So if you have questions, please drop us a chat or you could speak of or request to join us. Let's hear from you. If you have a question for Doc before he logs out, we would like to hear from you. Please drop us a chat so we can quickly take your questions. I'm trying to look at who and who is online at the moment.
So if I understand correctly, you guys are online in YouTube, right?
Yes, we
Do
are
you
live
have
on
people that
YouTube.
joined? Can you see
Yeah,
your
I think I
audience?
can see. Just a minute.
Okay,
Okay. It's already said it's already streaming, so I'm trying to see if I can get the people online to ask their questions.
okay.
Yes. You're online. Please drop us a chat. If you have a question for Doc, he's ready to answer your question. Don't be shy. Just drop us a question and Doc will answer it before we round up. I want to quickly check on my phone. All right.
Just before then, tomorrow we have a special event in our
Yes, I was.
if you're someone that loves twins, triplets, quadruplets, we have a special masterclass tomorrow. So today is the deadline to register. Some people might start with no babies and they can end 2025 with 4 babies. Some people can end 2025 with 3 babies. Some people can end 2025 with 2 babies. And some people can end 2025 with 1 baby. So whatever your situation is, come out from your comfort zone, take massive calculated actions, and you will be so surprised what God has in stock for you. Seek
Yeah,
help. The earlier you seek help, the better.
the better.
Especially if you have the resources. If God gave you the resources, there are some people that want to take the best actions, but they don't really have the resources. So, what about you? You have resources, but you're not spending your resources appropriately. The best thing that will happen to you and your family is to have your babies. If you want to have your babies, there is no amount of money or resources you spend towards having your babies that will be too much because your babies necessarily do not have a price tag. So leverage on all the opportunities you have out there, especially in this era of social media. Make sure that anytime you're in social media, you're going to groups that will empower you, groups that will give you what you need to overcome whatever challenges you're going through. All right. It looks like
All
we don't
right.
have any
So
questions, right?
yes, nobody dropped any question. So we'll take it up. I would still reach out. If there's any question, we'll drop it for you. You
Okay.
answer for us before the next one. So I think that's how we'll do it.
Okay.
So
That's
thank you so much, Doc. We are so glad that you joined us today. You've been of tremendous, assist. And the conversation today has been so enlightening and empowering. For me, because I have gone through that journey, I understand 100%. So for every other person listening, I really hope you learned a lot. And like Doc said, you need to seek help early. Don't say I'm not married yet or oh I'm not looking to get pregnant yet, so you just sit down. No, you can just do your the way you do your annual body check for different things. Include checking your vitals as part of it. Check your tubes. Be sure that everything is all right so that once you're ready, it's a free flow. So thank you so much. Um, and to our listeners, I want to, to take a moment to acknowledge how challenges this journey can be. But I hope that today's conversation reminds you that you are not alone. There are options, there are resources for us to take. There are resources that you can actually take that would help you. And I know that the journey is not always easy. It's not as easy as we all make it, sound. But just be assured that what God has in plan for you is that you will have children. The Bible states that the Lord has blessed us with everything good, and that children are a blessing from the Lord, and He will definitely bless. He said, "Go and prosper." So you prosper in everything. So to our listeners, I want to take a moment. I just want to say that take the action today. Like Doc said, he has a program tomorrow. You can still join today. And I'm joining. And I know a few of my friends have also paid and are joining. So please go ahead, get options. If this episode, blessed you, please share it with someone who might hear, who wants to hear it, and who will be blessed by it. And let's spread the awareness and hope together. I also want to hear from you. If you have questions, please share, send us a chat. send us an email. You can share your story with us as well. If you've had your babies already, but you want people to be blessed by your story, please share with us. You can reach us by email at infertilitydiaries87@gmail.com. Your voice matters, and your story could help someone else out there. So please don't just keep quiet. And then before we go, I want to leave us with a thought. Fertility journeys are deeply personal, and no two paths are the same. But through it all, there is strength in seeking support, courage, and in exploring options. And I hope you knowing that you are never alone is very important for me. I want you to keep remembering that you're not alone. So thank you so much for tuning into episode 10 of Fertility Diaries. If you enjoyed this episode, please leave us a review, subscribe, and share with others. It truly means so much to me and help that you can reach other people with this video and the informations that you have heard. So until next time, stay hopeful, stay strong, and remember you are not alone on this journey. Thank you, Doc, for having us. Thank you
Thank you.
so much for joining us. And remember that next episode is going to be very interesting. Doc will still be joining us. He's part of the family now, and we are also going to his page to also join his community. So thank you, everyone. This has been episode 10. See you next time. Bye bye, everyone.
Thank you so much. Bye bye.
Bye.